Hi, I'm Rafe Roberts, Chief Executive of NHS Borders, and I'd like to spend just a few minutes talking about our local health service. We aim to provide safe patient care, and we're very proud both of our reputation and the commitment of our dedicated and hard-working staff. However, as a society, we're all expecting more from our healthcare services every day, and providing the service the way we want is not always easy. Personally, I'm very clear that NHS Borders, as the provider of a local health service, should be seen as part of our local community, and we therefore want you to be involved and engaged both in the care that you receive on a day-to-day basis, but also in shaping how we provide services in the future. So what does all this mean for the future of our health services? Firstly, we want to be able to provide healthcare in the right place, at the right time, and by the right member of staff. This will mean more patients cared for at home or in their community, and for us to spend more of our resources on services outside hospital. To do this, we will work more closely with social care and create a single team that will support all your health and care needs in the community. This should ensure you only get admitted to hospital when you really need this, and if a hospital admission is needed, then we will look to make this as safe and as short as possible. Obviously, some people will always need to come into hospital, and we will continue to provide acute hospital services on the Borders General Hospital site, except when it is more appropriate for you to receive specialist treatment in a hospital in Edinburgh, perhaps for complex heart or cancer treatment. Information and digital technology has changed out of all recognition in the last 20 years, and no doubt this will continue. We want to use this technology to support you at home and provide new ways of accessing services such as virtual or remote clinics, so that you don't even need to travel to speak to a doctor or nurse. There are also opportunities for our staff to work differently. Many of the tasks that would normally have been done by one member of staff is now being done by somebody else. For example, when you visit your GP practice, you may well now be seen by an advanced nurse practitioner or a pharmacist, who can do many of the things that a GP would previously have done. This allows our GPs to concentrate their skills and experience on the patients with the most complex needs. This is a good use of our resources, but also helps with recruitment challenges and provides a great opportunity for our staff to have more interesting and rewarding work, and in turn that improves our ability to recruit and retain other members of staff. We must therefore think carefully about how we create services that are sustainable with the workforce that we are going to have in the future, and not the workforce that we currently have. So in conclusion, the underlying message is that we must embrace change. Healthcare services change and evolve over time, and if we do not embrace this, we will not be doing the best for the Borders. We have approximately £250 million to spend on healthcare services each year, and while we know we could always spend more, our budget is limited. It is our responsibility to provide you with the best possible healthcare from our budget. As we move into 2020 and the coming decade, our clinical strategy and recently published statements of intent set out just some of the ideas we have about what we want to achieve and what this might mean, so that we can continue to provide the best possible healthcare in the future. However, it is really important to me that we get your views and thoughts on the future. We're therefore looking for your input and would like to involve you in our future. Please therefore do get in touch and get involved in shaping what, at the end of the day, is your NHS.